Alright, the next exercise we're going to perform is called the Sidelying Hip Abduction, so abduction. Now what the hip abduction is basically using your gluteus medius, it's a muscle, a stabilizing muscle on the side of the hip, to basically raise the leg away from your body. So what we're going to do is we're going to get into a side-lying position and we're going to place ourselves against the wall. So we want to have our hips nice and stable against the wall, so that way you're not turned forward or turned back. So basically you want both sides of your butt touching the wall, and you can grade this exercise by either making it easier by moving your knees up a little bit into your thighs up into flexion, or to make it harder on your hips you can move your legs a little more into extension. But we're going to start off with flexion here. So when we start off with the hip abduction, we want to stabilize our hips and our trunk, so we don't want to be moving from our trunk here. So we're going to take our top hand and we're going to stabilize our hip here, and we're going to slowly move into abduction, and then we're going to externally rotate our hip. So what we're going to do from there is move the foot down, so that way the hip kind of points more outward, and then rotate it back in and then bring it back down. Up, rotate out, and down. Up, rotate out, and down. If we want to make it a little more difficult, we can then straighten the legs, rotate, down, up, rotate, rotate back in, and down. So a very simple exercise. Very important, however, for being able to stabilize your hip joint. So if you tend to have a lot of knee pain or low back pain, and we tend to pronate if the doctor tells you have flat feet, a lot of times people have weak gluteus medius muscles and will benefit from this exercise. Again, great postural stabilizer exercise, very slow paces and very controlled movements to be able to go and work that muscle properly. And it's the Sidelying Hip Abduction exercise.